What are mycotoxins and why are they important in veterinary toxicology? Mycotoxins are toxic secondary metabolites produced by fungi, especially Aspergillus, Fusarium, and Penicillium species. They commonly contaminate animal feed, especially in humid storage conditions. Aflatoxin B1, one of the most potent mycotoxins, causes liver damage, immunosuppression, and cancer in poultry and pigs. Zearalenone mimics estrogen, disrupting reproductive cycles in swine. Since animals often consume large quantities of feed, even low-level contamination can have serious cumulative effects, making regular screening and good feed storage essential in veterinary practice. What is the significance of liver in toxicology? The liver is the primary detoxification organ, playing a crucial role in metabolizing xenobiotics through enzyme systems such as cytochrome P450. It converts lipophilic toxicants into water-soluble forms for excretion. However, this function also makes it a common site of toxicity. For instance, chronic exposure to pyrrolizidine alkaloids in plants can cause irreversible hepatic fibrosis in grazing animals. Liver function tests, ALT, AST, ALP, are vital in diagnosing and monitoring toxic exposures in veterinary medicine. What role do kidneys play in toxicology? The kidneys are responsible for excreting water-soluble toxicants and their metabolites via urine. Their high blood flow and active transport systems make them susceptible to toxic injury. Nephrotoxicants like aminoglycoside antibiotics, for example, gentamicin, and heavy metals, for example, cadmium, lead, accumulate in renal tissue, causing tubular necrosis. Clinical signs include dehydration, polyuria, and elevated serum urea creatinine. Monitoring renal function is essential when administering potentially nephrotoxic drugs. What are neurotoxicants? Neurotoxicants are substances that damage the nervous system, impairing cognition, coordination, behavior, or autonomic functions. Organophosphates, carbamates, pyrethroids, and certain metals like lead are classic neurotoxicants in animals. Signs can range from tremors and seizures to paralysis and altered consciousness. In one example, ivermectin toxicity in collies, due to MDR1 gene mutation, causes central nervous system depression, showing the importance of breed sensitivity. Rapid recognition and supportive care are key to preventing permanent neurological damage. What are endocrine disruptors in veterinary toxicology? Endocrine disruptors are chemicals that interfere with hormone synthesis, secretion, transport, or action. These can be natural, like phytoestrogens, or synthetic, like bisphenol A, pesticides, or industrial chemicals. In animals, they may cause infertility, altered puberty onset, thyroid dysfunction, or reproductive organ anomalies. Zearalenone, a mycotoxin, acts as an estrogen mimic and is notorious for causing swollen vulvas and false heats in pigs. Endocrine disruption can affect not just individual animals but herd reproductive efficiency. What is oxidative stress in toxicology? Oxidative stress occurs when reactive oxygen species, ROS, overwhelm the body's antioxidant defenses, damaging lipids, proteins, and DNA. Toxicants like paraquat, a herbicide, generate ROS, leading to pulmonary fibrosis. Acetaminophen overdose causes oxidative liver injury. Antioxidants such as vitamin E, selenium, or N-acetylcysteine are often used to counteract this damage. Evaluating oxidative stress biomarkers, for example, malondialdehyde, glutathione levels, can help assess toxicity severity and guide treatment. What are heavy metal toxicants? Heavy metals such as lead, arsenic, cadmium, mercury, and copper are persistent environmental toxicants with multi-organ effects. Lead toxicity causes anemia and neurological signs, especially in young animals. Chronic copper accumulation in sheep leads to hemolytic crisis and hepatic necrosis. These metals often bioaccumulate and are difficult to excrete. Diagnosis involves blood or tissue assays, and treatment typically includes chelating agents, for example, EDTA for lead, D-penicillamine for copper. Preventive strategies involve regulating feed content and environmental exposure. How is activated charcoal used in poisoning cases? Activated charcoal is a first-line treatment for many ingested toxicants because of its high adsorptive surface area, which binds toxins in the gastrointestinal tract, preventing absorption. It's especially effective against alkaloids, glycosides, and many drugs. However, it's ineffective for metals, for example, iron, lithium, alcohols, or corrosives. Administered early, ideally within 1–2 hours, it significantly reduces systemic toxicity. It is often followed by a cathartic agent to promote elimination. What is the role of chelating agents in toxicology? Chelating agents are substances that bind heavy metals in the body to form stable complexes that are then excreted, usually through urine. Common examples include calcium EDTA for lead poisoning, D-penicillamine for copper toxicosis, dimercapril, BAL, for arsenic or mercury chelation must be carefully dosed and monitored to avoid redistributing toxins or depleting essential minerals. These agents are life-saving in cases of metal toxicity and are part of many standard veterinary protocols. What are the general steps in managing a poisoning case in animals? Management involves a systematic approach. Stabilize the animal. Maintain airway, breathing, and circulation. Prevent further absorption. Induce emesis if safe, administer activated charcoal, or perform gastric lavage. Enhance elimination through diuretics, cathartics, or chelation for metals. Administer antidotes specific to the toxicant, for example, atropine for organophosphates. Supportive care, fluids, oxygen, anticonvulsants, or liver-kidney protection. Identify and eliminate the source to prevent recurrence. Quick action and understanding of the toxicant's nature are vital for recovery and prognosis.